So good evening, everyone. Welcome to our Alumni Day of Action event, which is Lockdown Life. I'm very pleased to be chairing this session. My name is Judith Rankin, and I'm Dean of Equality, Diversity and Inclusion in the University. I also am Professor of Maternal and Child Health in the Population Health Sciences Institute at Newcastle University. So our plan for this evening is I'm going to ask the panelists to introduce themselves in a moment, and then they're going to run through some slides just to give you some context about the project. And then we'll open up to a panel discussion, and we would welcome any questions that you have. Please post the questions in the question and answer, and we'll pick those up. So first of all, I'll invite John Niblo to introduce himself. Thank you, John.
Hi, everybody. My name is John Niblo. I'm the Chief Executive of Any Youth, and we are a regional youth development charity based in Blaydon now. We provide infrastructure support across the youth sector, as well as direct programmes for young people. We've been involved with Steph in the project in a number of ways, but more recently we've been supporting a group of young people that have contributed to the co-production workshops in the second phase of the research. So we're very excited to see what comes out of that and how that will inform future services and provision for young people.
Thank you, John. And then I'll introduce Dr. Steph Scott. Could you just say a few words about yourself?
Hi, everyone. I'm Dr. Steph Scott. I'm a Senior Research Fellow at Newcastle University. So I'm interested in young people's health, young people's well-being, and with a particular interest in young people in challenging circumstances, or possibly young people involved with the justice system, experiencing insecurity or health inequalities in some form. Thanks, Judith.
Okay, so I think we'll move on now to some slides that the team have prepared just by way of background to the project.
Yeah, hi again, everybody. Yeah, just a little bit about the organisation that I have the privilege to be Chief Executive of. So we're Any Youth. We were formerly Northumberland Boys Clubs, then Northumberland Clubs for Young People, and you know we work across the region. We work collaboratively with our good friends at Youth Focus North East, where we've created the North East Youth Alliance, which is very much around looking at culture shift around collaboration within the youth sector, to ensure that services are coordinated and joined up, and we avoid duplication across the sector. And also a key feature of the North East Youth Alliance is to improve the voice of, well, to improve the opportunity for young people to have a voice across the region in services that impact on their lives, and particularly more so through COVID and as we come out of COVID, you know, to ensure that there is a voice for young people, but also workforce development to ensure that staff, volunteers at all levels in the sector have the skills, the knowledge and experience to work effectively with young people. And there's our vision and mission on the screen there. We got involved you know, initially with a conversation with Steph, where we were delighted to be invited to be a partner. We were able to get our hands on some resources to support the initial cohort of young people with some vouchers to kind of reward and acknowledge their involvement. We also set up some stakeholder conversations on the back of the first phase, where we took some of the initial findings to the sector, to senior workers across the youth sector. And then, like I said earlier, more recently, we've had a group of young people from one of our direct delivery sessions who have been working with Steph and Alex within the co-production workshop. So we're delighted to be involved, and we're really looking forward to see what comes out and how that will help us to shape and inform future services.
Going. So a bit like the partnership with John and North East Youth, this particular project is a strengthening of a number of really early conversations that myself and Alex and Carol had about 2 years ago now, about ways in which the university and operating theatre and the North East and North Cumbria applied research collaboration could work together. And an opportunity presented itself with this project. So Operating Theatre are a regional organisation who have had a really long-standing relationship with Newcastle University, a really long-standing relationship with the medical school in particular, around co-producing art-based pieces of work that are research informed. Alex and Carol have played a really heavy role in the co-production workshops, which I'm going to tell you a little bit more about in a few minutes, which we just did the final one last night, so I'm really looking forward to seeing what produced.
Thank you, Steph. My name is Alex Ellett. I'm the Artistic Director of Operating Theatre. As Steph very kindly pointed out, we have a long-standing relationship with Newcastle University, in that Carol Clulow and Julia Darling had very strong connections with the university. Carol is a writer in residence, and that's how Operating Theatre came about. We are solely interested in working in and around health, so promoting health, thinking about health, making dramatic pieces that are related to health and well-being. So when we had a discussion with Steph, this seemed like a really good fit for us. A couple of the pieces that I wanted to mention were Squirrels, which is a piece around young people and mental health that was created through a lot of interviews, working with clinical researchers and people involved in promoting mental well-being among young. And so that happened several years ago now, but when Steph approached us with this idea, it seemed to make perfect sense to continue that. The reason I've put down Lockdown Life, Liturgy, and V by Tony Harrison is that Liturgy is a piece made with Sean Byrne and Paul Summers, and was text led, but then we created a filmed visual response to that piece. And V similarly was a piece made at Northern Stage quite some time ago, but again led by text. Deep Mind was a research project into non-operable forms of epilepsy and neural implants. So again, we worked with researchers, clinicians, patient groups, and so on, and created a film drama. But this piece, Lockdown Life, is something that comes absolutely from the thoughts and the concerns and ideas of the young people that we worked with. And as Steph pointed out, we finished our last session, but I'm hoping it's not a break with the group, because I just want to say to John, we've had a brilliant time. We've been fantastically welcomed by Caroline, all the team, and it's been a great place to go and speak to people. Thank you. Thanks, Steph.
Thanks, Alex, very much, and great to have you on the panel. So Steph, I think we'll have the next slide, and then we'll hear a bit more about Steph and about the project.
Yep, thank you, Judith, and thank you very, very much, Alex. And yeah, just to echo what Alex said, we've already made plans to go back and do the first launch with the youth group, because they're really keen to see what the piece is going to look like. So yeah, thank you for having me. I'm Steph Scott, and I'm just, before we move into a Q&A, I'm going to tell you a little bit about the project and about why we decided to do the project. So I think one thing that's apparent from what we've talked about so far is that the project kind of strengthens collaborations and sort of multi-agency partnerships that we were already trying to develop. So it solidifies a relationship with North East Youth and a relationship with Operating Theatre. So I work for Newcastle University, but I'm a senior research fellow within the North East North Cumbria Applied Research Collaboration, who are also supporting this piece of work. I'm going to ask you to move the next slide, please, if it's all right. So yeah, I'm just going to tell you a little bit about the project. But after I've run through what we've mainly found, I want to talk more about the things that we've learned about working in co-production with young people during a pandemic, if that's okay. Next slide, please. So yeah, I think this timeline that I've put up is meant to represent at a really broad level the challenges and the changes and the experiences that young people have faced over the last 18 months. Now that is really, really difficult to read. And I think in itself that tells you something. So from the period of time from around about the end of February 2020 up until possibly July, August of this year, 2021, people have gone through an enormous amount of changes. They've gone through changes to school in particular. So we've had home learning, we've had bubble systems, we've had actually experiencing COVID themselves, and all of the physical and emotional challenges that that brings. Next slide, please. And what we set out to do through the Lockdown Life project is back in around about April time of last year, we were really sort of troubled, I guess, that there was not a lot of research that was attempting to capture young people's voices. So young people were being talked about a lot, but they weren't necessarily being talked to. And I mean, things have moved on since then, and there's a growing body of work that talks to young people. But at the time that we set out to do this study, the most that we had were some national surveys about the experiences that young people were having. So we wanted to examine how young people in the northeast of England felt about the pandemic and how it had impacted them. We also felt that we wanted to capture their journey, for want of a better word, through the pandemic. We didn't feel that a one-off interview would do that, because we felt that things were changing so rapidly that that wouldn't begin to capture the experiences that young people were having. But we were challenged by sort of social distancing, by lockdown, by not being able to be in contact. So we decided we were going to do some kind of correspondence study, a longitudinal study, and we set out to capture young people's experiences through curation of diaries. So we asked young people to keep a flexible diary about their experiences, and by flexible I mean it was unstructured. They were asked to tell us how they felt and the experiences they'd had in any format that they wished. So that could be text, it could be pictures, it could be drawings, they could send song lyrics, they could send poetry, they could send anything they wanted. And then we conducted a series of in-depth interviews at regular points of time. And we kept that study going through a number of phases for about 17 months. And we spoke to 31 young people throughout the course of that 17 months, and around about 26 of them stayed with us for the entire time. And the final part of the study, which Alex has just been telling you about, is kind of using the findings of that work and almost taking it back to young people and almost sense checking it in a way, in order to hold co-production workshops with a different set of young people in order to produce an artistic piece, a sound and vision piece based on their experience. Next slide, please. So I'm going to tell you a tiny bit about the overall findings, and then I'm going to tell you a little bit about what I learned. So in terms of key findings, as you would expect, young people talked a lot about the impact that lockdown and social distancing had on mental health and well-being. So they missed their friends, they missed their grandparents, which came up again quite significantly in co-production workshops. They missed distant family, and they missed the routines and structures that go alongside of seeing people. So, you know, jokes, hugging, you know, sort of sensory things like contact, they missed quite significantly. Young people also talked about disruption and the changes that they'd faced in terms of education and school life. So they obviously had the challenges that come with home learning, but the most significant challenge that young people discussed was a real sense of uncertainty. Like from day to day, they couldn't quite rely upon the fact that they would be in school. It was the in and out nature, and almost having the rug pulled out from under them that was significant. And finally, they talked a lot about frustration and a sense of responsibility that they felt for other people's health as well as their own, and a frustration on 3 different levels: with other people, with the rules themselves, and with the rules that were being the people who were setting rules, so the government. And at the moment, we're kind of trying to take that longitudinal data set. It's a lot of data and make sense of it. We're trying to use storytelling to make sense of that, and sort of creative techniques like poetry. So I've just included an extract from one interview transcript where we've kind of played with putting that into sort of think something called I poems, where they center the narrative on that person in the first person, and that's just one stanza from that person's narrative. So I made the decision to keep myself, my family, and my community safe. I wasn't going to meet anybody outside of my social bubble like friends. I know this is the right decision. Sometimes I feel left out and just sad. Sometimes my friends push me. I know I'm doing the right thing. And I think when you take away the noise and kind of center that in the first person, it becomes quite powerful. Next slide, please. So yeah, I'm just going to round off with a few reflections from me. The first thing is, you know, like I said at the beginning, young people have been through a period of unparalleled social change. And on the whole, they've dealt with that with grace and with responsibility and with resilience. And I think it's important to point out that young people overall will suffer impacts, but that young people in the North East will potentially suffer greater impacts than some of their counterparts in the South. And I guess for me, what I've learned from collecting something like a diary over a really long period of time is that diaries can be a really powerful research method, but with great power comes great responsibility, I guess, for want of a better way of putting it, because there's a reason that diaries are quite intimate. They're very personal, they're very powerful, but they're also very emotional. And I think being so close to data like that for such a long period of time can take a toll. And I think hopefully we'll touch on this in the Q&A, but working in co-production has been really, really important to this project at all stages with North East Youth and with Operating Theatre. But I think my challenge really to take back is that it takes a really massive level of commitment from higher education institutions. And I think there's a big discussion to be had about how co-produced research can be really strongly supported. Thank you, that's all from me.
Okay, so thanks very much to Steph, John and Alex for giving us that context into which we can now move to a panel discussion. So as I said at the beginning, really invite you to post your questions on the chat and we'll try and pick up as many of them as we can. Just to get us started, I've got a few things I'd like to hear a little bit more about from the panel. So Steph, you've talked a couple of times about the importance of the co-production and obviously you want to talk a little bit more about that. I wondered if you could, just for everyone who's on the call, maybe just say a little bit more about the principles of co-production and what is the ethos in terms of we hear a lot about co-production, co-produced, engaging, all of these kind of phrases, but maybe just to say a few more words about what the ethos of a co-production piece of work is.
Yeah, absolutely. I think for me, what's most important in terms of the ethos that I wanted to take is that people who have lived experience are involved at every level of the research process. So young people shaped the initial ideas that we had. We spoke to young people about how we wanted to collect the data, whether they felt that was going to be a sensible approach. And so in terms of involvement, they were involved in shaping that original idea. And then, like John pointed out at the very beginning, we then had involvement and engagement at different levels. So there was engagement from young people about their initial project ideas. We went back to the sector halfway through and kind of said, these are sort of the ideas that are coming out of the initial analysis. How do you feel about this? How does this impact on your sector? And kind of took that co-production and engagement to the sector as well as just young people themselves. And then I think finally, the co-production workshops are really key and they're central. And that's about young people shaping the narrative that they want to present as well. And kind of what we were really hoping they would do is really take on the challenge and kind of say, actually, that's not the experience that I've had. My experience has been like this. And there were lots of parallels with the research data, but there was lots of points of difference as well. And I think that just kind of shows the importance of looking for diversity when working in co-production as well, if that makes any sense.
No, that's great, thanks. And I suppose John and Alex, is there anything you want to add in terms of the methodology and your experience of going through that co-production process?
Yeah, I mean, I think for me, the most important thing is that, young young people have that opportunity and within their own safe environment, which is their regular youth club on a Monday night, and you know, they have that opportunity to say, look, yeah, like Steph said, this is how I'm feeling, this is what how it's impacted on my life, in that kind of supportive environment, when no one's judging them, and they feel empowered to have that voice. And they know that they're part of something much bigger here, that they can feel really proud of being part of. I mean, I haven't been directly involved, but I know my colleague Caroline has really enjoyed the kind of the process and the sessions that she support young people with Alex and Steph. So it's been a great opportunity for our organisation, but most importantly for those young people to be involved at the heart of something really positive.
Yeah, just to add to that, John, I'd say that right from the very first session, I was blown away by just how open and welcoming those young people were. You know, they didn't know us at all. They'd obviously, something had been discussed, you know, and it perhaps explained to them about what was going to happen. But from that first session, they started to talk frankly, honestly, very clearly about what was going on, and also to express confusion, ambiguity, all of the things that they've experienced in that time, you know, and the sessions have been incredibly rewarding in that respect. Yeah, that's what I would say. I think, and we showed them a very brief example of what the piece might look like in the end, and what was really encouraging was that they really understood it. It felt like it came from them, not just their words, but the way we were presenting the material and some of the techniques we were using in terms of the film and so on. So that was really, really great.
So we'll return to some of those points, but we've got a question in the chat. So for all of you, so you can have a think. How can we make young students happy during this period? So what really struck a chord with me, Steph, was when you were talking about how resilience the young people had been. So I suppose, is there anything more you can say about that? Or have you got any thoughts that have come out from this work with young people? What were they suggesting themselves that could make them happy?
I don't know if I know how to make young students happy, but I think one thing to touch upon is I probably didn't make it clear in the presentation that not all of the emotions and experiences that young people had were negative. And I think that's really important to capture, in that actually there were aspects of the pandemic and what comes with a pandemic that were welcomed by some young people. So, for example, a number of the young people felt closer to certain family members. The noise of life got taken away and everything kind of slowed down, and some people appreciated that. For some young people, school is the source of their anxiety. So when that was removed from the equation, life was a little bit more positive. It was they felt like less pressure to perform and in front of peers and other people. So yeah, I think that might be something in terms of resilience to really, really capture. And I think for some young people, it was the length of time of the lockdown that was problematic, not necessarily lockdown itself, if that makes any sense.
Just a tiny thing to add to that. There were people who spoke to us who said that it was an opportunity, that the pandemic presented itself as an opportunity to really change behaviours, to reflect on how they had been, how they'd perhaps been, who they'd been associating with, and how their lives had been, and to make quite radical changes. So in a way, they kind of chosen the path that they preferred to take. They in some cases changed pretty dramatically how they were interacting with people, who they were interacting with, even how they described themselves. You know, and that was really quite surprising at the first, but we heard several examples during the sessions that were really quite marked changes in behavior and attitude and so on. And also a thing to remember is that these people have gone from being 14, 15, 16, and they have grown in whatever way they have, but they are different people now, and that we've seen time and time again.
Thank you. Yes, and I have one of those at home. She started this at 15, she's now 17, and I've noticed a really big change. So that's interesting. So we've got a question that relates to inclusion criteria for the young people. So we haven't touched upon this yet, but it would be interesting to know exactly how you approach defining the inclusion criteria and what were the inclusion criteria that you used for the study.
Yep. Okay, so it was a qualitative piece of work. So there were inclusion criteria, but it's possibly wider than some studies, in that what I was looking for was to get variation in perspectives. So the young people, they were aged 13 to 17 for starters. But other than being aged 13 to 17, there wasn't really any inclusion criteria per se. But as young people were being recruited into the study, I very clearly set out to capture different ages, different gender, and different socioeconomic backgrounds. So in the project, rather than co-production workshops, the very first 31 young people we had, I can bring the exact details up, but we had pretty much an even split in terms of gender. And often in studies, particularly qualitative studies, we end up with more females than males, but actually we had quite an even spread and an even mix across genders. But what is more important is that we marked people's socioeconomic status according to the postcode they gave us, and we then looked at the index of multiple deprivation, and we had a really good spread between the most deprived and the least deprived, so it wasn't skewed basically, which was really nice. But I guess the caveat to that is, in the big study, the young people are not what we would classify as challenged circumstances, or vulnerable, or even marginalized in some ways. So it was very much general population young people, if that makes sense.
So we've got questions come in that did ask actually just exactly what you're talking about male and female. Okay. And the different socioeconomic. So you've been able to answer that. But another part of that question is about including those aged up to 26 as young people. Now, you've obviously said that your age cutoff was 13 to 17. Yeah. Could you say a little bit more about why you sort of truncated it at 17? Was that for practical reasons, or was that for something that the young people said themselves?
I always it's a really, really tricky, the age boundaries of young people and adolescents and young adults are always really tricky to navigate, aren't they? And there is different ways you can kind of explain. But I always feel like that young people who are 18 and above have a very different experience to young people who are under 18 in terms of, generally speaking, unless you've gone into the employment world, when you are under 18, you're still in a further education context rather than a higher one. And really what I was interested in is the experience of young people who were in mid to late adolescence, experiencing middle or high school, basically, if that makes sense.
And John, I don't know if you have any particular sort of comments or anything to add about that in terms of the sort of age groups that were included.
Yeah, I think so certainly in terms of the co-production workshops, it was important to try and get a group of young people that were at a certain stage in their own group development, so they could kind of embrace this opportunity and be able to articulate, with the support of Steph and Alex, how they're feeling and engage effectively. It would have been tricky to jump into like a brand new group that was still kind of forming. But certainly, I think the studies captured a good spectrum of ages and backgrounds, and I think what comes out of it can be used for further consultation with different groups, and we'd be certainly keen to take what comes out of the findings to other groups of young people that we're working with directly, to see how that can shape and inform future projects.
Just a tiny thing to add to what John and Steph have just said. We've certainly spoken to people very recently in sessions who've talked about the difference from school and college and the impact that has had on them. And I would say massively positive. They feel that they're being treated in a completely different way, that there's a sense of equality there in terms of approaching problems and challenges. It's very much the staff and that young person versus the challenge, rather than being told, just get on with it, you should know how this is, come on, you're a grown-up, you know. So they felt very differently. So again, just reiterating that notion of having passed a certain Rubicon, moved on, you know, they have developed throughout this process, and we've seen some of that in the sessions.
Thank you. We have a question around matching what this person uses, the phrase mental ages with physical ages. I think you've already said, Steph, that you didn't recruit anybody who had a particular vulnerability or was in a particular circumstances. But I suppose that leads me to think, well, in the best will in the world, you've done your best to try and get a really good sample of young people. But do you feel that there maybe were some voices missing from your sample, which, you know, is inevitable in any work like this, isn't it?
Yes, yeah, it is inevitable. And this was kind of, we needed a place to start, if that makes sense. And so we're trying to capture that diversity in sort of splinter work, if that makes sense. So some of the co-production work in part does that by working in areas of socioeconomic deprivation in a much more stringent way. And we're also working on a project that follows up some of the findings, but works with young people from the Bangladeshi community in Newcastle. And then finally, my particular wish is to do work that focuses on the impact that the last 18 to 20 months has had on people who are justice involved, young people who perhaps are involved themselves or have a family member that's involved in the justice system.
Thank you. So we have another question that's come in that's talking about different mental health issues for young people living in the north and in the south. And there are potentially very different reasons for that. But the questioner is asking whether you, and presumably from your experience through this project and also your experience with working more broadly with young people, would agree with that statement, that maybe there are more mental health issues in the north of the country than in the south. Would you like to comment on that?
I think we do have a context where young people in the north are experiencing inequalities and certain conditions that are more exacerbated than in the south. I'm not very sure about the sort of the very short daytime stuff. That's definitely not my area of expertise. But that we do possibly what we tend not to focus on sometimes in the northeast is the diversity in terms of it's not necessarily just sparse population, it's the diversity that we see. So we've got the urban context, and we've got rurality in sort of Northumberland and then further south of the Tees. But we also have the inequalities that we might experience in terms of coastal towns as well. So there's a lot thrown into the mix there that we need to take into consideration in the northeast.
John, I don't know if you've got any comments on that, given I'm sure you work across the network of young people's groups, whether you'd want to make any comments about that.
Yeah, I think, you know, just to pick up on Steph's final point there, you know, the northeast is a really interesting area. It really is. I've been fortunate to work in a number of different local authority areas, which are all very different. I certainly recognise from spending lots of time working for Durham County Council Youth Service some of the rurality challenges around working with young people, and certainly in certain parts of Northumberland. Look, before lockdown, mental health was a huge concern across communities and particularly for young people. And sadly, it's got worse. You know, I've never particularly been one to get involved in the north-south conversation. I'm only really interested in the northeast. I'm only interested in the young people that we work with and how we can make a difference. And certainly, we're seeing some difficult challenges and issues with young people. And within the resources we've got, within the collaborations we have with other stakeholders, you know, we're just working as hard as we can to address some of these issues. And these reports, these research projects are vitally important to how we challenge policymakers, funders to increase resources in the North East and provide the best quality services we can for our own young people.
And I'd certainly reiterate Steph's point about health inequalities. You know, that they are marked in some parts of the region. You know, people's life expectancy, access to services, and so on. And that obviously has to affect things. I know that this is being picked up all over the country, but certainly in the Northeast, there are some stark contrasts in terms of access to services and support.
Thank you. Let's move on now to talk a little bit more about the young people themselves. So I'm really impressed that you were able to keep 26 young people engaged throughout what was almost 17 months, I think you said, of this project. That's a long time to keep anybody, any subject in a project, but I wondered whether you thought there was any particular reasons for that, or anything that you as a project team did to really, you know, encourage and make sure the young people wanted to stick with you?
Oh, that's a hard question, but there are some things I think to touch upon. I think that for the young people themselves, particularly in periods of lockdown, I actually think that they got as much, that this is my interpretation, but I feel that from what they said to us at the end, that they got as much out of the project as we did, in that, particularly in periods of lockdown, it almost felt like a diary. I think using a diary method rather than just constant interview method, it almost removed my presence as a researcher, and they felt that they were talking to a diary at a lot of the time, particularly when they weren't. Every now and again I would respond because, you know, ethically and for building rapport, there were things that young people said that warranted a response. But a lot of the time, young people were saying things as though they were just, you know, writing things down in a diary. And I think that helped with engagement. They felt like they had someone to rant to, which is what they said often. But there was, you know, with less social contact, that helped at times. The other thing that potentially helped, I think, maybe was the interviews that we held every 2 to 3 months. We could kind of use the diary entries as springboards, really, for more conversations. I'm trying to think of anything else that we did that might have encouraged people, but actually I think that we might have been really lucky, but young people seemed really engaged, and I think the method really helped.
Yeah, great. Anything else to add, John or Alex? Was there any feedback from any of the co-production workshops that might sort of throw some light on that?
I think we certainly did a brief question session about how people had felt about the sessions and so on. I think the fact that people were just allowed to talk, they all said, you know, the sessions flew by because we created an environment where they felt they were going to be task-based sessions. They felt they were going to have to jump through certain hoops or whatever, but we didn't present that. I think I certainly echo the Steph's notion of of trying to remove our voice from the, you know, so listening a lot more, talking a lot less, and just letting them talk and express themselves in the way that they wanted to. They obviously modified and modulated what they said. I think we had one swear word, you know, there was that kind of thing, but we weren't censoring, we weren't saying there were things that they could and couldn't say. We just wanted them to just talk as openly and freely as possible.
So it sounds as if you created an environment in which they felt that they would feel comfortable and that they would be listened to, which, you know, is a great testament to you as the team that created that environment. So just to say that we haven't lost Steph, she's just gone to get her charger for her laptop. But whilst Steph's sorting her laptop out, I'd just like to, maybe John and Alex, what was it about this project. I'm sure you've had lots of people come with lots of different projects to do with young people over the pandemic. What was it about this project that spoke to you and you really wanted to engage with it? John?
Yeah, I mean, before this project, I didn't kind of know Steph. I was introduced to Steph, and I think, you know, part of this project is how Steph's approached it. You know, I bought into what Steph was trying to achieve straight away, and I think it came at a good time, because I think as an organisation we were struggling a wee bit about where we were and what our priorities should be during that difficult period, and I think maybe we wanted something to cling on to help to guide us and to guide young people, and to ensure that young people had a voice. So, you know, once this was presented to me by Steph, you know, we were sold. We wanted to be part of this, and as a regional youth organisation, we quite rightly should have been part of it. But we were really delighted to be invited to be involved, and yeah, we jumped on it straight away, and we'll stick with it. And we'll use it as best we can to fight for better services for young people, where young people have a voice in those services.
I'd say similarly in terms of jumping at the opportunity. When the discussion came up, it was a whole body of work that already existed. The diary entries, some of the responses that were being received then. We saw a real opportunity to try and articulate some of those thoughts, as Steph mentioned, to take them back to young people and see how they responded to those, but also to make something that would genuinely reflect how they were feeling. So we went in with the very clear idea that it would be anonymized. They would be free to say whatever they wanted. We weren't going to censor anything, and that we would try and do and serve those experiences, that their way of expressing those experiences. So it was just the fact that we were given an opportunity. I showed Steph an example, which again I mentioned, which was a liturgy, which is heavily text-based, and then it was a visual response to that work as an opportunity then. So to gather their thoughts and their ideas, and then to make a piece of work that really reflected that. So that's a great opportunity for us, and it's absolutely an area that we thrive in. You know, that we feel it's very important to engage with people, and then we've always tried to reflect our findings from those experiences.
Thank you. And John has touched upon the sort of next steps for the project, or how the project findings will be used in terms of hopefully influencing maybe how services are developed as we move into the sort of recovery and reset period of this pandemic. But I think those listening would be interested to know, what are the plans for the project, and also not just from within the team, but I'd be very interested also to hear about what you think the young people would like to see as the next step. So should never ask 2 questions in 1 question, but I'm afraid I have. So let's go back to, what are the plans? Obviously you're not finished yet, but what would be the plans, the next steps?
I'll take this, Judith. So I'm about this high in analysis at the moment, maybe like slightly drowning. But yeah, we spoke. One of the key things that I did in the final set of interviews was to ask young people what they would like to see happen to the findings of the study. And so obviously there are a couple of things. We've been discussing the piece that we're producing with young people, and that's one way of making sure people are aware of how young people have felt over the last sort of 16, 17, 18 months. We've got the normal academic routes that we take, but like I said to the young people in the study, no one except researchers read research papers, and we asked them what they felt that we could do with the data. And one thing that we are doing is, as I said, I'm playing with poetry and stuff, and what we want to do is, young people sent drawings and pictures and all kinds of things. So I want to put that into a booklet that we potentially send to youth groups or schools or sort of other organisations that support young people, that's in a format that young people would read, and young people seem quite supportive of that idea. So we're looking at the best way to do that. But in terms of future steps, I think the obvious future step is, I think there's an idea at the moment that the pandemic is over, and it's really not in terms of. We spoke to the young people at the last workshop last night about that, and their opinion, Alex, I'm sure will agree, is that it's very much not finished, and that there's a chunk of life that is just missing, and they're playing permanent catch up to that chunk of life that they've missed. So my clear next steps are kind of to explore how young people are dealing with life at the moment. It's kind of almost hybrid in a way, isn't it? And also to try and diversify the work into different groups of young people.
Thanks. And any comments in terms of, John, how has it influenced your organisation, and how will you take the learning forward for your organisation?
I mean, the first thing we're going to do, which we've talked about, is have some sort of celebration event, which involves the young people and an opportunity to invite stakeholders to that. That would be an excellent way to kind of kickstart or launch kind of what our plans are, and involve other people in that conversation. Look, I mean, the fight goes on to in terms of trying to get more resources into the sector for young people. And these reports, like I said earlier, the findings are really important to help us to influence policymakers, commissioners, and funders. I think what the North East does lack, it lacks investment from some of the large national funders. And that's not suggesting that's their fault. I think we have to take some responsibility for that. But certainly I know that funders are looking to fund work in the North East. So we need to join some of the dots, and we need to work collaboratively, to ensure that we don't miss an opportunity to kind of share the voice of young people during this difficult period, to bring in new resources. And that's certainly what we stand for as an organisation. We stand for for fighting for better services, better resources, and better quality opportunities for young people. So we'll keep trying to do that.
And a thing that we as Operating Theatre have been in discussion with several schools and trusts with right throughout this year is taking similar projects and similar findings into school settings, to work in a very different way, to do a kind of half-weekly takeover where we involve staff, where we involve students, where we involve volunteers, parents, carers, all kinds of people in open discussions about the challenges, because I think, as has been pointed out in some of the questions, the mental health challenges going into the next 2, 3, 4 years are going to be substantial, and I think we need to be where we can be, and offer what support we can, and a creative environment where people can express what they're feeling, have some outlet, and then seek responses, from whoever we can get them.
So thank you all for that. I'm to the questions that have come in. So we have a question here around digital exclusion, which obviously has been a real feature of the lockdown, and whether you felt that was an issue in terms of the young people's ability to remain connected during the pandemic, and whether maybe that came out in some of the young people's narratives, or in the poetry or drawings or things that you talked about, Steph. We know that has been an issue for young people, and I suppose think it's a little bit more detailed about whether you found that with your young people.
I think it's come out more in the co-production workshops, which demonstrates the importance of those workshops than it did in the study itself. So as I say, we got a mix of socio-demographics and socio-economic status of households, but the young people that were in the core study were not significantly marginalised. So there was a report that came out, was it last week or the week before, that really highlights just how big the digital exclusion divide is particularly in the North East. And I think we recognise that in the paper that we published on this particular study, that it's a limitation. We told young people they could keep in touch any way they liked, but what we couldn't do is we couldn't offer paper diaries because everybody was locked down and schools were remote, and if schools were open, then that would have been our route, and we just didn't have a way of getting paper diaries to young people that we didn't already have a relationship with. So we told them they could keep in touch by, they did Instagram DMs, they did Facebook, they did email, but we also offered SMS in the way that we thought that, yes, they would still need a mobile phone, but they wouldn't need the internet, if that makes sense. So we tried to offer as many options as we could, but yes, that is a significant problem in the Northeast, and it is a limitation of what we do.
Yeah.
Thanks.
Sorry, I would just add to that with another project that I've been involved with. Digital exclusion came up time and time again, that people were really struggling if they had 2 or more young people, who needed access. It was a real challenge, and yeah, people had it was mentioned very recently, that people felt that they had missed out on a whole chunk of education, and the online resources had not been adequate, or they didn't get enough feedback. There weren't enough opportunities. There wasn't enough time given to them online when they could get online. So yeah, it's a tricky situation.
Okay, thank you. To my great surprise, we've got 5 minutes left. I'm not really sure where that whole hour has gone. And just in the last few minutes, I wondered whether, if you could take yourself back and do this again, what would you change? Is there anything about how you've approached the project, how you designed the project, how you implemented the project? Is there anything that you think you might change with, obviously, that hindsight now? Should you?
I don't know. I'm thinking desperately. I don't think I would change what we did. I think this was a mad, crazy idea I had with no funding initially. So no, I think that I wouldn't change what I had done, but I would be very keen to do more, if that makes sense. Obviously, this particular project is at the end of its funding. But yeah, really keen to explore what more we can do in the next coming 18 months.
Yeah, absolutely. I have to agree with Steph 100%. I think that this has just shown us what a great opportunity it is, and how much more we can and should be doing, to really engage in a meaningful discussion and gather real experiences from people who need a voice, who need to be heard, and we need to get their ideas and their thoughts out there.
John?
No, I don't think so. I mean, obviously, we had a very different kind of position within the project. So again, we were very much here to support Steph and Alex, and to support the young people to get involved. So no, we've done that, and we will continue to do that. So no, I wouldn't have anything to add on that point.
Well, nobody's saying that they wouldn't do it, so that's fantastic. So I think we're going to wrap up now. We've got a couple of minutes left, and I think we'd like to put on a slide which just links to the work that you've been doing. And if anybody would like to make contact, I'm sure you will encourage people to make contact with you afterwards if they would like to do that. So I think what's left for me to do is just to thank each of you very much indeed for taking part in this panel discussion. So thank you to Steph, to John, and to Alex, but also to extend a really sincere thanks to all the young people who took part in your project, for being so honest, for being so engaged, and for sticking with it, which I think, if we reflect back on the different periods of the lockdown, that is really testament to how important this project is. And to wish you all the very best with the analysis and with the next steps for this project. So thank you all very much. And then just finally, just to remind those who are listening, that we will be launching a poll after the event, and we would very much appreciate it if you could provide some feedback. So thank you all very much. Thank you to those who've been listening. I hope you've enjoyed the event, and thanks for joining us. And I hope you enjoy other events that you may be going to dial into over the next couple of weeks. So thank you all very much.